Okay, we're going to go ahead and call the meeting of the Lakeshore Hospital Authority Board of Trustees to order. At this point, I'm going to unmute all of the trustees, and their audio will be unmuted throughout the entire meeting, along with Dell and Mr. Coberline. I want to make a few comments. We appreciate the fact that people are participating in our government. This is our first virtual or CMT meeting. And as much as we have tried to rehearse this individually, we may make mistakes. So please be understanding of that fact. If you are dialed in on your telephone, you can press *9 to raise your hand. And then you would press *9 to put your hand down whenever after you were called upon. If you're dialed on the telephone, you can press *6 to unmute whenever you're called upon, and *6 to mute again. So we ask that everybody respect the time limits that are placed on public comments. Also wanted to mention that I received a text message before the meeting stating that the advertisement on the homepage was different than the advertisement on the agenda and in the newspaper. I did want to note that I spoke with staff about this, and we have followed all protocols that the Special District Accountability Act calls for. So I want to let the trustees know that that staff agrees that we are in compliance with our meeting notice. Are there any staff or trustee addition or deletions to the agenda or the consent agenda?
Mr. Chair, I'll make a motion to approve the agenda. Swisher.
Got a motion by Mr. Swisher to approve the agenda.
I'll second that.
Got a second by Lori. All in favor, signal by saying aye.
Aye.
All opposed, motion carries. Public comments. So what we'll ask you to do is raise your hand if you would like to make a comment during public comments, and we will go through them as we can. I do want to remind you that we will allow comments at each individual action item, and all comments are asked to be kept at 3 minutes or less. So I see Walt. I'm going to unmute you, Walt, so you can make your public comment.
I was just unmuted. That's Stephen Douglas. That's me.
Okay, Stephen Douglas, you're under Walt, so I appreciate knowing that now. So I
was wondering about
down.
that.
Stephanie Jolly, if you will press *6 on your phone to unmute, and you can go ahead with your public comment.
I'm so sorry. That was an accident.
Okay. Are there any individuals wanting to make public comments tonight? Ms. Lemley.
Okay, do you hear me?
Yes, ma'am.
Okay, did you receive the email I sent to Sonia to send to all the trustees?
I'm at the Hospital Authority building. I noticed that it was received at 4:19, so I'm not sure if it was sent to all of the trustees, but it will be before
Oh,
the
man, I meant to bring them up.
end of day.
Dinner. Dinner with me?
What can I read it so it'll be read into the record?
I'm sorry.
Can I read what I sent to Sonia because I was having difficulties getting it to send through Comcast today? So can I just read what I sent?
Yes, ma'am. Go ahead.
Okay, it's time for the Lakeshore Hospital Authority to go away. In 1940s, the population of Lake City was 5,800. During World War II, a number of institutions were established to help with the war effort, as well as those in Lake City. The hospital was dedicated in 1940 to provide medical care for those in the Lake City area. In 1955, the Lakeshore Hospital Authority District was created. On July 10th, 1963, it was established and governed by a special act of the Florida legislature and amended with, further amendments. The purpose of the authority is to provide temporary relief to the indigent of Columbia County and the city the cause of their poverty, to seek a plan for permanent rehabilitation, generally to assist them to support themselves whenever possible to the end that may be ceased to be a charge upon the community, instead become useful citizens, and to bury the indigent dead of Columbia and provide cemeteries. The enabling legislation that was adopted in 2005 does not take into consideration the hospital is not operated by the Lakeshore Hospital Authority. They made a mistake. The legislation did not address the fact that it was a leased facility. The citizens and taxpayers should be given the opportunity to weigh in if they wish to continue the operation of the Lakeshore Hospital Authority Board, and I've done so on multiple times. When Commissioner Tim Murphy was on the board, he said the hospital should be sold. The board members are collecting and spending the taxpayers' dollars unnecessarily. The board are not being good stewards of the finances of this authority. As a taxpayer, I have absolutely no input as to who sits on the board, since the members are appointed by the governor's office. The Lakeshore Hospital Authority board members are a board of political appointees. It is unfair. I pay taxes and others pay taxes and have no input. The only resource is to express my concerns at these public meetings, and I've done so at legislative delegations. The hospital authority has a triple net lease. The authority and the people of Columbia County are not obligated by the terms of the lease for maintenance, taxes, and insurance and renovations. The Lakeshore Hospital Authority needs to go away. The Lakeshore Hospital Authority needs to be dissolved, and that can only be done by an act of the legislature. One board member still thinks this is a community hospital, but it is not. You as a board member can make a motion to ask the Columbia County Commissioners to place on the ballot for the next election the following question: do you think the Lakeshore Hospital Authority should be dissolved? Let the people vote and decide if they want to keep the authority. It's up to you guys to make a decision on the authority. Thank you.
They can see you.
Thank you, Ms. Lemley. Mr. Lilker, you're unmuted.
Thank you very much, Mr. Chairman. Can you hear me okay?
Yes, sir.
Yeah, you look like a movie star on the screen. This works
Well,
a lot
thank you.
better than the WebEx. This was a good choice for the authority to use Zoom. I have a comment. I sent you a text before. I would just like to point out that the meeting notice on the front of the website was different than the meeting notice in the agenda packet. Not that anybody could find the agenda packet. And I would also like to advise the authority and the board members that this meeting notice was not in Florida public notices. While that might not seem important to the board members, you should take notice that not everybody is a subscriber to the local mainstream media, the Lake City Reporter. So if you don't get the Lake City Reporter, you would never know if you guys ran a public notice somehow in the newspaper without having it published in the Florida public notices that this meeting was even occurring. So your announcement, while it was nice at the beginning of the meeting, clearly is subject to question, because people that don't get the newspaper, the mainstream newspaper, the one that the Florida legislature deems to be the official mouthpiece of the Lake City Reporter, of the Lakeshore Hospital Authority, and other municipalities in the county, is not accessible by everybody. So you said you did a legal public notice, but if you look where legal public notices are, I would just like to point out to you and this board that legal public notice cannot be found on the internet. So I think that needs to be looked into, and I question the whole veracity of this meeting based on that. The people that might have wanted to know about this certainly would not be able to find out about it. Thank you very much, Mr. Chairman. I'll reserve the rest of my comments when the meeting comes up and the agenda items come up. Thank you very much.
Thank you, Mr. Lilker, and I just have to say I'm disappointed that I don't get to see you on the screen tonight. So maybe next time we'll
maybe we
get
can
you
have a
on
date.
video. We'll move on, and I will entertain a motion to approve the consent agenda.
So moved.
Got a motion by Lori,
Second, Swisher.
got a second by Mr. Swisher. All in favor, signal by saying aye.
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 All opposed? That motion carries. Move on to unfinished business, and I will defer to Mr. Williams.
Thank you, Mr. Chairman, trustees. The first item of business under unfinished business would be to extend the current state of emergency. This is resolution number 2020-004, and I will read into the record the resolution. Okay, let me get there. This is a resolution of the Lakeshore Hospital Authority. It's a resolution of the Board of Trustees of the Lakeshore Hospital Authority of Columbia County, Florida, extending the declaration of a state of emergency arising from the COVID-19 public health emergency. And it states, whereas the novel coronavirus disease 2019, commonly known as COVID-19, is a severe acute respiratory illness that can spread among humans through respiratory transmission and presents with symptoms similar to those of influenza. And whereas in late 2019, a new and significant outbreak of COVID-19 emerged in China, and whereas the World Health Organization previously declared COVID-19 a public health emergency of international concern, and whereas in response to the recent COVID-19 outbreak in China, Iran, Italy, Japan, and South Korea, the Centers for Disease Control and Prevention has deemed it necessary to prohibit or restrict non-essential travel to and from those countries. And whereas on March 1st, 2020, the governor issued Executive Order number 20-51, directing the Florida Department of Health to issue a public health emergency. And whereas on March 1st, 2020, the State Surgeon General and State Health Officer declared a public health emergency exists in the state of Florida as a result of COVID-19. And whereas on March 7th, 2020, the governor directed the director of the Division of Emergency Management to activate the State Emergency Operations Center to Level 2 to provide coordination and response to the COVID-19 emergency. And whereas the Center for Disease Control currently recommends community preparedness and everyday prevention measures be taken by all individuals and families in the United States, including voluntary home isolation when individuals are sick with respiratory symptoms, covering coughs and sneezes with a tissue, and disposal of the tissue immediately thereafter, washing hands often with soap and water for at least 20 seconds, using alcohol-based hand sanitizers with 60 to 95% alcohol if soap and water are not readily available, and routinely cleaning frequently touched surfaces and objects to increase community resilience and readiness for responding to an outbreak. And whereas the CDC currently recommends mitigation measures for communities experiencing an outbreak, including staying at home when sick, keeping away from others who are sick, limiting face-to-face contact with others as much as possible, consulting with your healthcare provider if individuals or members of a household are at high risk for COVID-19 complications, wearing a face mask if advised to do so by a healthcare provider or by a public health official, staying home when a household member is sick with respiratory disease symptoms if instructed to do so by public health officials or a healthcare provider, and whereas based upon information, advices, and warnings from the various agencies identified herein, the Board of Trustees, in order to protect the welfare and safety of the citizens of Lakeshore Hospital Authority and their property, finds it necessary to extend the state of emergency declared pursuant to Lakeshore Hospital Authority Resolution 2020-002 and extend the terms and conditions of said resolution. Now, therefore, be it resolved by the Board of Trustees of the Lakeshore Hospital of Columbia County, Florida, as follows. The above recitals are all true and accurate and are incorporated herein and made a part of the resolution. The Board of Trustees extends the state of emergency pursuant to Lakeshore Hospital Authority Resolution 2020-002, as well as the provisions included therein, and continues to authorize and instruct all the Lakeshore Hospital Administration and the various departments of the Lakeshore Hospital Authority Administration to take all emergency action which is prudent and necessary to protect the welfare and safety of the employees, clients, and citizens of Columbia County. The Lakeshore Hospital Authority Executive Director is hereby authorized to make emergency purchases of supplies and services resulting from the COVID-19 public health emergency. Says this resolution shall be effective upon adoption and shall expire at midnight on the 7th day from said date unless extended by the board chairman. It is closed by being passed and adopted by the Board of Trustees on this date, and it has the signatories for signature. And we present it for approval, Mr. Chairman.
Before I accept the motion for approval, is there any comment from the public? Seeing no raised hands, I will entertain a motion for approval of resolution number 2020-004.
Motion to approve. Mr. Chair, I'll make a resolution to approve resolution 2020-004, extension of the current state of Florida emergency. Swisher.
A motion by Mr. Swisher.
Second.
Second, I believe that was Dr. Thompson. Is that correct?
Correct. Dr. Thompson.
Got a motion and a second. All in favor, signal by saying aye.
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 All opposed? Motion carries. Mr. Williams?
Again, thank you, Mr. Chairman. The next item, I am seeking permission from the Board of Trustees to issue a request for proposals. I realize the packet that you have in front of you says request for bids. However, after discussing the intended scope of work, it is my belief that our interest would best be served by receiving proposals instead of straight bids. The reason for this is we are putting the onus of any asbestos and lead paint removal that may exist or that does exist within the Bedoya building on as the responsibility of the awarded contractor. We're not going to do two separate projects. We're going to do a single project. So this package would be changed to reflect a request for a proposal. We would receive proposals. Those proposals would be ranked and then presented back to the Board of Trustees for award. And so tonight we're simply asking for permission to issue a request for proposals.
Ms. Limley, Go ahead.
I looked and I have not been able to find any motion and vote which is required before a governmental agency disposes of a property. So I think going forward with this is not allowable.
Okay.
My
So
comment
I
would
don't think
be,
you can,
I'm sorry, Barbara, go ahead.
no, you go ahead and I'll respond.
Barbara, I have no dispute at all that the board has to declare the property as surplus property. And also, in this particular case, the Board of Trustees will have to seek this as being released from the lease with Community Health Systems. Those are two required steps that must be done, and certainly am I in no way suggesting that those not be completed at the appropriate time.
Well, I think those need to be done before spending the effort and the publication costs and vendors submitting work for something that could possibly not happen, considering CHS's current state of affairs.
Well,
So I think
again, I obviously have no issue at all with what you're saying as far as what is required. I don't know that there is a better order in which to do them. Certainly, we intend to have this declared as surplus property and removed from the lease at the appropriate time.
And if
before
it's
this
removed
project-
from, as you are well aware, if it's removed from the lease, that affects the amount of taxes the CHS pays. And I feel that it needs to be, put on the market for sale and see what happens. Give it a couple months and maybe somebody will want to buy it and we're not worried about it, and sold it as is. And I have no further comments on that. Maybe Stu will have something.
Thank you, Ms. Limley. Mr. Lilker, you're unmuted.
Thank you very much, Mr. Chairman. I'd just like to comment that this platform seems to be working very well, and you folks seem to have your act together. It's about a bazillion times better than WebEx. And you look very handsome tonight, by the way, as does Mr. Koberline. I would like to point out to you that if you look at the minutes that you're approving tonight, or have approved, I may have missed that, the March 9th minutes, it says in unfinished business, it says, once the survey has been completed, the board will be updated on the results and they can decide the outcome of the Bedoya building. Well, it would appear to be, as Ms. Lemley has pointed out, that you're putting the cart before the horse. It would seem that the board would need to, number one, declare it surplus property. Number two, begin to work on disengaging with CHS from the lease, if indeed CHS survives another month or two, and that seems to be in doubt. And number three, ask for proposals if people want to buy the building, rather than spending money to bulldoze a piece of property which clearly in that part of town may have use to somebody and may be of greater value than the cost of the authority to rip it down. I would suggest that you and Mr. Swisher are running for public office, and you guys should give this serious and deep consideration before even putting out proposals to demolish a building. The Lakeshore Hospital Authority in the past, if you look around the Lakeshore Hospital Authority campus, has demolished every building in the downtown. And all those buildings, at least some of them, had asbestos removals, and all one would have to do is look at those bids and they could determine the approximate price of what it would cost to demolish the building. That clearly could be taken into the board's consideration. Your primary responsibility to this community is fiduciary. And in emails that I read, and I'm just about done here, by Ms. Chancey, when she said they're not the board, the Lakeshore Hospital Authority is not responsible for the people. The Lakeshore Hospital Authority is the people. They're the one that pay the taxes that keep the authority in business. So again, I hope that you surplus the property, ask for proposals to buy before you put out bids to demolish it, and point out that if you look at the Zoom screen tonight, there probably are more people attending this meeting than have cumulatively in the last 10 years, and I hope that you consider to continue doing these meetings the way you're doing now. Thank you very much, Mr. Chairman.
Thank you, Mr. Looker. Also, we've had a few people join in since the meeting started, so I also wanted to just remind everybody, if you do have a comment on a specific item, if you're dialed in on the telephone, if you press *9 to raise your hand, and then whenever you're done speaking, you would press *9 again to put your hand down. And then once you're called upon, if you hit *6, once you're asked to unmute, that would unmute your phone, and then *6 again to mute whenever you're done speaking, just as a reminder. Are there any other public comments on this item, line item, before the board discusses it? Seeing no hands raised, what are the wishes of the board?
I move that we make, that we ask for proposals for demolition or removal of the building.
We've got a motion by Ms. Chansey.
I'll second Swisher.
Got a second by Mr. Swisher. Is there any further discussion?
Mr. Chair, Swisher here. I'll just say that I take no issue with the two public comments that were made, but I also agree with Mr. Williams that we have to start somewhere and, examine all the issues. And I'm fairly confident that the proper debate will occur of the future of that building when the proper time comes.
Thank you, Mr. Swisher. We've got a motion and a second. All in favor, signal by saying aye.
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 All opposed? Motion carries unanimously. We'll move on to new business, resolution number 2020-003. Mr. Williams.
Thank you, Mr. Chairman, trustees. This is resolution number 2020-003. It is a resolution of the Lakeshore Hospital Authority honoring Rhonda Sherrod, RN, MSN, for her many years of dedicated service to the citizens of Columbia County, Florida, and the Lakeshore Hospital Authority. And it states, whereas Rhonda Sherrod has served the medical needs of Columbia County, Florida for 33 years, and whereas Rhonda Sherrod has served the medical needs of Columbia County, Florida in various capacities, including but not limited to a registered nurse, hospital administrator, chief executive, and a chief executive officer for local area hospitals. And whereas Rhonda Sherrod has served in these capacities with great leadership, care, and compassion for her patients, medical staff, employees, and volunteers. And whereas Rhonda Sherrod has a long and appreciated relationship with the Lakeshore Hospital Authority, trustees, and staff, who one and all are appreciative of the contributions made by Rhonda Sherrod in promoting the needs and benefits of the Lakeshore Hospital Authority to Columbia County's qualified citizens. Now, therefore, be it resolved that the Lakeshore Hospital Authority, on behalf of past, present, and future clients of the Lakeshore Hospital Authority and the citizens of Columbia County, do hereby recognize Rhonda Sherrod for her many accomplishments and tireless efforts to promote good health for all. And it's closed by saying unanimously passed and adopted. There's a signatory for all members of the Lakeshore Hospital Board of Trustees, as well as the trustee attorney. This resolution, of course, would be appropriately framed, and it would be presented to Rhonda at another time when hopefully there can be some gathering. But we do ask the trustees to approve it at this time.
Motion to approve.
Got a motion by Dr. Thompson.
Second, Swisher.
Got a second by Mr. Swisher. Is there any comment from the public? Seeing no raised hands, I will entertain a motion, or excuse me, do we have a motion and a second for resolution number 2020-003? All in favor, signal by saying aye.
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 All opposed? Motion carries unanimously. Invoice approval for O'Neill Roofing Company, Mr. Williams.
Thank you again, Mr. Chairman. We do have the first and final invoice for what we, of course, termed our Roof-O project. Roof-O, for those that are listening in, was one of 12 different roofs over at the hospital building. We were having some pretty serious problems with it, and so it was made a separate project unto itself. There were no change orders, there were no additions to the low bidder, and so the final price was exactly what was bid, $169,450. Again, this is a first and final, no progress payments were previously made in this matter, and we submit it for approval.
Motion to approve.
A motion by Dr. Thompson,
Second, Swisher.
second by Mr. Swisher. Is there any public comment? Seeing no raised hands, all in favor, signal by saying aye.
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 All opposed? Motion carries unanimously. Moses Engineering, Mr. Williams.
Again, Moses was one of the technical people on the Roof-O project. They have submitted their final invoice for this project in the amount of $3,048. It too was exactly as proposed. There were no changes or additions to the amount of the professional services agreement of Moses. Therefore, we submit and ask for approval.
Motion to approve.
Got a motion by Dr. Thompson,
Second, Swisher.
second by Mr. Swisher. Any public comment? Seeing no raised hands, all in favor, signal by saying aye.
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 All opposed? Motion carries. Moving on in the agenda, received an email from Jack earlier this afternoon stating that there would be no hospital update. So unless it's noted otherwise, we will skip that portion. Also, since we're doing our first virtual meeting, Ms. Cynthia has asked everybody to refer to your agenda packet for the staff report. And we will move on to board member comments. And I will start with Ms. Chansey.
I don't really have any comments for tonight, but
Okay.
I find this very interesting to have a meeting this way.
Yeah, I think it's worked out very well.
Yes, I think it has.
Mr. Swisher?
I'll just say I appreciate everybody tuning in, and I appreciate the comments that were made, and I also look forward to being able to recognize Ms. Sherrod in person with this proclamation or this resolution that was passed tonight. Thank you.
Absolutely. Dr. Thompson?
No comments. Thank you very much.
Thank you, Doc. Walt or Stephen Douglas, do you have any comments?
Nothing special, just wish I was there in person and not battling with technology.
Mr. Coberline, do you have anything? Mr. Powell, do you have anything?
No, I'm fine. It was, but I can say it was a good Zoom meeting. I've been to numerous ones, and you're right up there in the A range.
All right. We have Mr. Carl here tonight. He's worked tirelessly for us to help us get this set up.
You did a good job.
So very appreciative of that. Mr. Williams, do you have anything else?
No, thank you, Mr. Chairman.
I just wanted to say myself that I'm appreciate everybody joining the Zoom meeting. I think that it's worked out very well, and we've noted that since the beginning of this, since we've invested the time and money into researching this, we would like to continue streaming our meetings even after this is done, hopefully sooner rather than later. But I did want to say thank you to everybody for joining in on the meeting tonight. If there's no other board member comments, I will entertain a motion to adjourn.
Motion to adjourn.
Mr. Swisher,
Second.
second by, I believe that was Mr. Douglas, or Dr. Thompson, I'm sorry. And we will be adjourned. Thank you all.
Thank you. Have a good night.
The call, that was a success.